Where's the camera? Wonderful. I'm going to wait for a cue to get started. And we're ready to start. Good afternoon. I'm Laura Jacobs. I'm co-chair of the COVID response team here at the University of Arkansas. It is an honor and a privilege to be here with you today for the Spring 2022 COVID Forum. We have got a live audience here in the Faulkner Performing Arts Center of about 45 or 50 people, and then we have another 520 who have signed up to participate online. So thank you all for your time here today. Let me just start off by saying that we have had hundreds, literally hundreds of questions submitted. And so what we'll try to do is to sort them topically and to be able to provide as comprehensive of an answer as we can to each of the questions so that we can touch on everything that has been asked and so that we can make sure that you get the answers that you are looking for. We will tee up questions for our panelists, and I'll introduce our panelists in just a second. And then we will, as we have time, we will go to the live audience for questions. There's a stationary microphone over to the side here, and we would ask that you stand up and go to the mic to ask a question. If you don't feel comfortable doing so, you can holler it out, and I will repeat it so that our folks online can hear the question that has been asked. Let's see, what else? Oh, and then we will also be sure to take questions virtually from our virtual audience. And so as people had the opportunity to register for this event, they did submit questions, so we do anticipate that a lot of things will be answered in that way. We are recording today's session. It will be available online perhaps as soon as this afternoon. And then I would be remiss too if I didn't also remind you that the answers to the questions being answered here today and submitted may likely be available on the COVID response website, which is available at health.uark.edu/coronavirus. So by hands up, thumbs up in the chat on Zoom, who has been to that website? Okay, super. I'm seeing lots of hands, so that's really helpful. That website is updated sometimes daily as information has changed quickly and rapidly. We want to make sure that the most recent and best information is available there. So quickly to introduce our panelists, and then we're going to jump right in. I want to start at the very end. We have Richard Ashworth, who is with Facilities Management, Health and Safety. We have got Dr. Huda Sharoff, who's the Campus Medical Director. Matt Mills, who is our Emergency Manager. We've got Mary Savin, who is the Chair of Faculty Senate, who's joined us here today. And then we've got Coleman Warren, who is the President of our Associated Student Government. We have Provost Terry Martin, who has also been part of the COVID response team since the beginning, and then Dr. Charles Robinson, who is our Chancellor. Joining us in the audience too, in case we need to phone a friend and need some help, we've got Debbie and Lisa from HR, so if we've got some HR questions that we may need a little help with, we can call on them. We also have, I think, Catherine Zarilla with the Graduate and Professional Student Congress, so if we need to get any help answering some things that we just can't handle with the panel, we will call our friends in the audience. So I think that's the housekeeping items, and we will just sort of get started. And I think what I'd like to do is sort of start off with hearing from the Chancellor. If you could kind of orient us to where we are and kind of tell us a little bit about our general philosophy. And I'd like to couch it in a question that came in from one of our audience members about a message that you sent last week. And you talked in your message about managing the situation and encouraging people to really be flexible in that. Can you talk to us a little bit about that?
Thank you, Laura. Hello, everyone. I just want to thank you for your time and your interest in having a discussion about how we're managing the educational enterprise while at the same time dealing with COVID, which we've been doing now for almost 2 years, which, in some ways should make us, experts, but I guess maybe not because of the conditions nuance a little bit. But again, thank you for your interest. And I also want to underscore that when we have forums, there is not, a desire to have a forum. Like we're not talking to each other and say, I can't wait till the next forum. The truth is, we have the forums because we are trying to make sure that the questions that the campus community might have can be addressed in some way, shape, or form, because we know these are challenging times, and they are. And there's no time when, as a campus administrator, you don't think about how should you do this or better manage it. And I know that when the Faculty Senate met with me, leadership met with me last week and asked for some kind of nuance, I gave it some serious consideration for this week. They never asked for the entire semester. I want to set that record straight. It was only for a period of time to see if we could create some flexibility in terms of the mode of instruction and whether or not people were working face-to-face or in a more flex way. And I looked at it and really looked at it from a safety standpoint of our classrooms. I talked with Dr. Sharoff and others about safety. And then I also looked at it from the standpoint of other campuses and what they were doing, how they were managing, knowing that their conditions were fluid. We discussed with the deans and got their input, and they talked about some of the courses they thought they needed to have face-to-face because of the type of course that the course was. And so looking at all those factors, what I realized is that as long as our classrooms were safe, I really had no strong justification for moving to a universal flex teaching mode position at this point. That the best thing to do, I thought, was to go forth with our plan for face-to-face instruction with our masking policy enhanced and trying to meet the needs of our students. I believe Coleman Warren will probably will reflect this. I have heard overwhelmingly from students their desire to have face-to-face instruction. And that doesn't mean that remote can't work. It just means that that's the preferred choice. And we know that learning outcomes at this point seem to be better with our face-to-face. So we're continuing this always with our eyes and ears open, but our concern about safety of our campus community very much in place. But the point I also wanted to emphasize was that I want the campus community to be compassionate and work with one another, people to look at the needs for people to have to work remotely in a temporary way on a day-to-day case-by-case situation, and to be responsive to that in a way that shows compassion. We know, again, that K through 12 might go on a pause, and we want to be sensitive to that with regards to those who have children and other conditions that we can nuance. So that was the part of the response that I really wanted to emphasize. Yes, we're face-to-face. I feel that it's the right place for the University of Arkansas to be, but at the same time, we need to be responsive to the needs of people to nuance their approach to managing the work responsibilities as far as we can be and continue our operation.
Thank you for that answer, Dr. Robinson. Moving along to Dr. Sharoff about testing. We have a whole bank of questions about testing, rapid tests, free tests, testing clinics, and the testing requirements possibly to end isolation. Can you talk to us just generally and specifically about testing?
Sure. There's a lot of questions and unfortunately a lot of confusion about that. So I'm just going to basically try to talk in general terms about rapid home test kits or rapid tests that you get in a clinic or in urgent care where you get a result in 15 minutes versus what we talk about are PCR tests. And those are the tests that you go into a doctor's office or an urgent care. Again, same nose swab, but it typically takes at least, well, it used to take 24 hours, but because of the increase in need and the volume for testing, we're now unfortunately seeing turnaround times of 2 days, 3 days. There have been some labs that have already been hit with issues of decreased lab supplies. Again, we've lived through all of this, right? We know this happened. We've cycled through this before. What I want to emphasize is two things. First of all, regardless of what platform test you complete, regardless of whether that is a rapid test or if it's a PCR test, If it is positive, it is positive. That means that you need to isolate. If you have symptoms, your isolation day 1 starts the day after you have developed your first symptoms. If you test positive and you have no symptoms, day 1 is the day after your nose swab, not the day after you get your test result, because we all know test results could take days. So your isolation starts the day after your nose swab. The reason I'm saying all of this is because we're getting a lot of requests through our clinic, and obviously through a lot of the clinics and urgent cares, and unfortunately the ERs in town, where we're having folks test positive on home kits, calling and want that test repeated. There's no need for that. A positive is a positive. And the bottom line is that if we knowingly bring in positive COVID patients into our clinic, they get swabbed. It's unnecessarily exposing other patients to COVID and our frontline workers to COVID. So a positive is a positive. Main message. The second message is that it is true that those rapid tests, home test kits, or even the ones we get in the clinics, they're not as sensitive to Omicron as they had been to Delta and the original COVID virus. They still can detect viral particles, but we know that they're missing some Omicron. If someone is symptomatic and has a rapid test, the result is a little bit more reliable. But if someone has no symptoms and they do a rapid test, the likelihood of having a false negative is pretty high. Again, false negative, not false positive. A positive is a positive. So we just need to function within the limitations of the testing that we have. Is it a bad thing to use the rapid tests? Absolutely not. It's better to test than to not test, because you may end up finding a positive, and that would be great. Identifying it early and isolating will decrease transmission. The PCR tests are the gold standard tests. Again, the nose swab. But these are tests that are done in a medical setting by medical professionals that are sent to labs with results that come back within 1 to 3 days. Those PCR tests are great for whether you have symptoms or you don't have symptoms. We use PCR, and the difference between the two, without getting in the weeds, is that the PCR test can detect actually the genetic material of the virus. That's how sensitive it is. The home kits are not like that. They're still good tests, they're just not as sensitive. So if we have someone who's a contact, who has no symptoms, and a PCR test is available, that's going to be the test we recommend. Now, because of shortages now that we're noticing nationwide, sometimes we can't be too choosy on what's available. So a test is better than no test. But again, we need to be able to educate ourselves on the limitations of each type. And so I know that the university is partnered with a third group that has started doing testing in the Union Mall as of yesterday. And they are doing testing 8 to 4, I believe, Matt. And that will run for the next several weeks. And it's a walk-up. So any campus community member can walk up with their university ID and insurance card, and they are doing PCR testing with results to be available the following day. So very fortunate as a campus, and the university chose to do this to give access, because that is a huge challenge in our community right now. And I'll end there.
Did you answer the question about the testing requirement to end your
Oh.
isolation?
Yes, okay. Thank you, Laura,
Yes.
for reminding me. Yes, I appreciate that. The other thing that I want to make very clear is that if you have someone who's had COVID and they have successfully completed their isolation period and met all the criteria for ending their isolation period, they do not need to retest for a negative to return to class or the lab. Again, this is not a good use of resources. And it's also not a good thing to bring known positive COVID patients into clinics, urgent cares, and emergency rooms. Again, we are trying to decrease transmission in our community, our county, our state, and our country. So we know that COVID tests can potentially remain positive for weeks. It does not mean that someone is infectious for COVID for weeks. And this is not unusual. People who have mono have a positive mono test. They could have a positive mono test for 6 months. It does not mean that they are spreading mono for 6 months. We also need to step back and think, when we diagnose somebody with the flu, do we really ask them to come back in 5 days and retest their flu test to make sure they're negative so they can come back into the classroom? We don't ask them to do that. They meet criteria and their symptoms are improving and they are fever-free for 24 hours. Studies have shown that COVID is most infectious 2 days prior to someone developing symptoms and for the first 2 to 3 days of those symptoms. That's why the CDC changed their isolation periods to 5 days. But again, 5 days meeting the criteria of symptoms improving and fever-free for 24 hours without ibuprofen or Tylenol. Then strict mask wearing in all settings, at least for 5 additional days. I am so thankful that our campus still has a mask mandate this spring semester. That makes that kind of a no-brainer in the fact that students are expected to be wearing their masks over their nose and their mouth while in any indoor facility here on campus. And so, but there are reasons that a lot of these guidelines had been changed. I mean, as medical providers, we get whiplash when the CDC makes these changes and has made 2 or 3 changes in 3 to 4 weeks. We're trying to sort it out ourselves, but then we have to read the data behind the decisions. And so please understand, if you are an instructor, if you are a professor, if you are a supervisor, and your student or employee has met the criteria for isolation and or quarantine, but mostly isolation, please do not ask them to show you a proof of a negative test before they can return to their lab or their classes. Again, tests are already in short supply and it is not a good use of resources. And testing can be found in other facilities in our community outside of the emergency room. Our emergency rooms are already bombarded and they're also being basically flooded with community members wanting just COVID testing. But please know that there are other opportunities in our area outside of an emergency room. They need to focus on those that are ill and likely need to be admitted.
Great, thank you for that.
Thank you.
This next bank of questions is for the provost and revolve around the opportunity for Zoom classes versus in-person, face-to-face. Why do we need to have detailed plans to shift to remote courses? Can you talk to us about the choice and how those decisions were made, Terry?
Sure. As Chancellor Robinson indicated earlier, you know, the safety of our community is the thing that's been driving our decisions. And we looked at this, and with our classrooms being safe with everyone masked, we are in the mode this last fall as well as this spring, teaching our classes primarily in person. We do have opportunities for when an individual has a disability or needs an accommodation through our OEOC, our office there, that they can go through that process, and those are accommodated. We do that in a variety of ways to meet those needs. But the vast majority of our classes are in person, which we know that's where obviously the students have overwhelmingly said we want to be in person. We know that that's what the University of Arkansas, that's what we deliver, that experience of being in the classroom, the collaborations, the parts, various aspects of that is where we're at. We have looked at remote. We said, well, where is the remote classroom in the future? And we had a task force that looked at that. Charles Robinson, as provost, appointed this task force last year. They looked at it. A lot of the things that came out of that task force are for the Teaching and Faculty Support Center that you use this fall in the classes, that all of that information. So that was very helpful for everyone. We have continued with a different task force, but almost the same, looking at it into the future. And this is continuing to ongoing work that we will be looking at. How do we use that into the future? So as far as the remote work for staff, we had a remote work policy prior to the pandemic that was outdated and not used a lot. So we on the fly, in the middle of the pandemic, tried to update that remote work request or that policy to address the inconsistencies across campus to try to make it better. We've improved it some, but we know there's more work to be done there. Myself and Vice Chancellor for Financial Affairs, Ann Bordelon, and I have put together a task force that's going to be chaired by Margaret McCabe to address some of the remote work. How do we do that as a campus? And we've got coming to kind of help us get started with that is an outside consultant with Ernst & Young that will help us look at how we can make the remote work for our campus. How are other institutions or organizations doing that? And I think that will be a very valuable thing for us going forward. It'll make us more competitive, but there's a place for it, and we're looking into it further. See, I had a couple other notes. As we start the semester, right now, we know we're going to have some remote work, remote classes. People are going to be remote because there's a variety of things that are happening right now in our community. The child care facilities, many of those are not operating at full capacity or reduced hours. That puts a strain on our employees that have children. The same with, we're going to have people that need to be at home, isolated and quarantined. They're not going to be able to come into the office. And so there's going to be classes that are going to go remote for a short period of time. There's going to be our staff that can't come in for periods of time. We've encouraged the supervisors, department chairs, deans to be flexible during these few weeks. And I think hopefully it's just a few weeks that we're going to have to be dealing with such high numbers. But we're trying to be flexible to deal with those on a short-term basis. And I know that as well as the students are going to have to miss as well. And I know that, as we said, almost 2 years, this has been really hard, and I know we're all kind of weary, but I know you've done a great job, the faculty and the staff, and I know the students are trying their very best to do the things that we ask, because everyone wants to have a good experience here at the University of Arkansas.
Thank you for that. You say 2 years, I say 3. Matt Mills, can you talk to us a little bit? There's a series of questions about the mask policy, mask enforcement. How can we make people wear masks? Can you talk to us about the realities of enforcement and what are some things people might do to help encourage this?
Sure. So I think everybody's familiar with the reality of the enforcement aspect of the mask. Our desire is that with the guidance and the requirements pushed out by the administration, by the chancellor, everybody wears a mask and everybody wears it properly. As we have seen across campus, that's not always the case. It has not been always the case since we started this journey 2 years ago in all aspects of our lives. So the enforcement aspect is going to be exactly as it has been in the past, and it's going to be through university student conduct and through HR. You can report those cases at report.uark.edu. It's the first 2 tabs when you pull up the website. It shows that you can file a report. you file that report, and then it gets disseminated to the right folks to start that process. UAPD will obviously respond to any call for service, but this is not, a mask wearing issue is not necessarily a UAPD response, unless there is an obvious disruption, a fight, or something of that nature. So our first desire and request, because that's what we're going to do when we get on scene, is to handle it at the lowest level possible, be that university conduct or HR, however the violator may be affiliated, student, faculty, or staff. If you don't want to use the website, from the faculty and staff perspective, you can go directly to your HR representative or call HR. There is an HR representative that is assigned to do COVID response. Alicia Wells is who we have been working with recently. She is more than capable of handling these situations and willing to do so. And then again, from the instructor, professor, faculty side, I'll defer to the provost as far as, how to deal with a disruption in the classroom itself, but you're well within your rights to ask that student and require that student to wear the mask properly. So if that does not occur, then the university conduct has also been extremely helpful in dealing with these situations when we get the reports as well. And I know that they've had a lot of cases where they've heard and adjudicated students specifically who have not adhered to the masking policy.
Thanks, Matt. So Coleman, that's a good segue to maybe the student point of view, and can you talk a little bit about some of the student leadership efforts with regard to the whole situation, mask compliance? Tell us your thoughts.
Absolutely. I speak to many students, and I hear from many students, and I can tell you that on a lot of issues, you don't get a lot of agreement, but on staying in person is something that I've had an overwhelmingly positive response from students on. And so I want to just first start by expressing my gratitude for our faculty and staff and everyone here at the university for facilitating an in-person learning environment for all of our students. It's really been something that's changed the dynamic of our university last semester and this semester. For what we're doing to try and make sure that it's safe is we want to make sure that students are wearing masks in the classroom, that we're respecting the health and safety of this entire campus community. And so that's why last fall we advocated to put in the mask mandate and to sign on to the letter whenever it wasn't legal to the governor to allow us to have a mask mandate. That was something I was happy to sign on to because we have to do this in a way that's thoughtful. And now, as we have an uptick of obviously the Omicron variant, I want to be sure that masking is really something that every single student is doing in the classroom and in all indoor spaces. And so I have been visiting with student groups and other student leaders to try and be sure that we understand that we're all on a team here. And if we want to stay in person, if we want to have the learning environment that we all desire to have, then that means that we have to be wearing our masks.
Super, thank you, Coleman.
Absolutely.
And then so maybe I'll go to Mary next and ask you a similar question, given the conditions, the policies, practices, and the expectation that we are in a face-to-face situation. Can you talk to us about what are the things we could be doing as an institution or need to be aware of from a faculty point of view? What are you hearing? What are the concerns?
Yes, thank you. So senators and faculty Senate Exec Committee hears a lot from faculty, and certainly in the last couple of weeks, we've been hearing from quite a few faculty. Probably similar to students, there's not always a lot of consensus on a lot of issues. So there is a diversity of input that we get, but I would say a few of the concerns that have risen from the input have been surrounding communication. So I do want to thank administration for having another town hall. As much as they say they don't sit around and look forward to the next one, I do appreciate it because faculty are concerned about the frequency of communication, the filtering of communication through the units. Sometimes there's miscommunication or how things are interpreted. So the direct communication, I think, is very, very helpful. I do appreciate the frequency of messages that have come out over the last week or so. I think that has been very helpful. There are a lot of concerns from faculty, and they do differ. There are people who are worried about when faculty get sick, when students get sick, when their children get sick, or the students' clothes, has been said. We are in the midst of a very long pandemic, and so the fact that faculty need to work with their department heads and supervisors and deans as disruptions occur and work as best as possible to get through this is very much appreciated because this is a difficult time, and we do need to work as a community, and people need to know that understanding is out there. There's been a lot of frustration with the mask enforcement, and so again, the appreciation for once you go into a building, the mask goes on, I think is again, some people can't wait to get these masks off, but I think is going to be very important because while there's a lot of compliance, we really need to make sure right now with Omicron that masks are on over the nose and mouth. So having that clear message of, okay, we're going to take the interpretation of 6 feet of distance away, and once you're in the building, the mask goes on, I think is appreciated. So the clear messaging is I think a very important component. We hear from faculty, clarity in messaging is important. Testing has been requested, so the 5 weeks of testing on campus, I think, will be very important for people. And I also wanted to mention, so, if you have younger families, there's a concern about schools, but we've also heard from faculty about, well, what if you're immunocompromised? And the Communicable Disease Committee has reached out to an immunologist, and they're going to come in and meet with that committee. Dr. Campbell is going to come in and meet with that committee on January 25th and provide feedback on how to work with immunocompromised patients. So I also appreciate that there's been response to those concerns. So faculty have expressed to us that they, to senators and again, the exec committee, that they don't feel that their concerns are heard or responded to. And I do want to express that this is a difficult time, but there are measures being taken to respond to a lot of concerns. It's not perfect, but there are responses being taken.
Yeah, thank you for sharing that. I really appreciate it. You mentioned the classroom and feelings of safety when faculty and students and staff walk into those classrooms. So this is probably a good pivot to Richard, who can talk to us a little bit about, I've got a series of questions about the fact that COVID is airborne, is easily transmitted. Can you tell us about our HVAC systems and what we have done to try to mitigate the spread through PPE, sanitation efforts, and that vein of question?
Okay, certainly.
Thank
Good
you.
afternoon. From the ventilation perspective, the first thing that we probably have learned, there'd been an argument early on about whether or not this was airborne. There was a lot of focus initially about the transference through large droplet surfaces, but there was a portion of the scientific community that maintained from the beginning that the airborne was a route that was more prevalent and needed more action. Of course, now that's flipped. It is airborne, and it's known. The one good thing from a ventilation perspective that we still do not see is it transported, surviving through the ventilation system. We still do not see that. We don't see it picked up in this room and then spread throughout the building. There's been no evidence. There's a few isolated cases with very specific ventilation systems, but overall, ventilation does not tend to spread it. So now you're focused on individual rooms and what's happening in those individual rooms and what risk they present. From a ventilation perspective, the thing that you want are two things. You want as much fresh air and as much air movement as you can get in that space. And so the Centers for Disease Control, the standard setting bodies that oversee air conditioning, ventilation, heating systems have made recommendations that the university follows. And that is basically to address those first two. How do you get fresh air and maximize fresh air? Two ways to do that. Open your windows, right? That's going to bring in a lot of fresh air. That's not practical in a lot of our cases. And how do you do it if it's not practical then? From a COVID perspective, the other good thing is you can filter it out of the air. In essence, you can make the air fresh by passing it over a filter, and if that air is recirculated, it is fresh. And that's what goes on in our buildings. The buildings' ventilation systems were maximized to bring in as much fresh air, outside air, as possible. Continue ventilation continuously, don't let it stop. And then to also upgrade all filters to the highest effectiveness that they can, that those systems will allow. And then that is focusing on doing everything that we can to maximize ventilation within the spaces. Having said that, are there locations and places on campus where it needs extra scrutiny? And the answer is yes. My office during this time has probably been in 100 different areas on campus, individual office, collective spaces, where we've looked at what the activity was going on that may present greater risk. What would that be? In some cases, if there wasn't masking, there's greater risk when you bring a lot of people together. And then in other cases, it's the number of people. And we have looked at those individual areas, and in those cases, and it's very few, out of the hundreds that we looked at, I can only think of 5 cases where we have made a recommendation on in-room air filtration. For the most part, what we see across the campus, large rooms like this, larger classrooms, is effective ventilation to address it. And going back to, again, what we talked about earlier, we don't see incidents that point back to that we're having an issue in spaces on campus. Can that change with Omicron? Because of the nature of it has changed. 70 times more multiplying factor for Omicron than Delta. It is different. We've talked about the 3 phases. In all 3 phases, there's been something different that we've had to deal with this. And so, yes, we are looking at it, but we're doing the surveillance. We're out and about every day looking at this. And so if there is a concern about individual spaces, just submit it to Facilities Management Service Center and we can take a look. But for the most part, all the buildings have been optimized and the ventilation has been addressed. Did you say a little bit about masking? Did you want to get in?
Why don't you hit on that? That'd be great, thank you.
Okay. And so the other question has come up is about effectiveness of masking. And are we going to get N95s and KN95s? And the short answer is we have KN95s on campus, but we're having to follow a distribution process initially that's a little bit restrictive to higher risk activities, and I'll speak on that in just a second. But from a masking standpoint, the bottom line is, for the most part, the Centers for Disease Control has not changed its masking outlook. Put something over your face is what's been there, whether it be it started with bandanas and gaiters, and then those were kind of no, but cloth mask, procedure mask, whatever it may be, get something that covers your nose and mouth. Most of that was for, frankly, breathing out, cough and sneeze and protecting that. Again, large droplet transfer was initially the focus that now has shifted to small droplets, small aerosols. When that has gone, then the effectiveness of the mask and the mask material has become more prevalent. And so a lot of focus now nationally is on what do I put on my face and what does the material need to be. What I'm going to tell you is, as you see across the panel here, everybody has their own preference. You're hearing a lot about N95s and to some extent KN95s as being the gold standard. And for filtration, that is true, but it has problems with it as well. And from that standpoint, initially the problem was they weren't available. So they were in short supply and we couldn't get them. And that's why the CDC didn't recommend them in the very beginning. Now that has changed. The supply chain has opened up a little bit, but not fully. But now, of course, with Omicron and how transmitting was happening, there's been a national discussion about should they recommend N95s and KN95s? And the answer to that, as you all probably know now, is yes, they did, just a few days ago. For us on the campus leadership approached FAMA weeks ago to say, we need to take a look at this and we need to be prepared if that recommendation change. And let's go ahead and start looking at supplies for at least KN95s. That was done. I will tell you from the FAMA perspective, it was a little problematic because their normal supply chain wasn't going to work for large numbers. You want to get 5, 10, 20? Yes, you can. As an individual, you can go out on Amazon right now and do the same thing for yourself. But as an entity who's trying to buy in bulk, there's still some issues there. Also, you have to concern yourself if you're looking at KN95s about counterfeit, and that you make sure that what you want to achieve with that material you are going to achieve. And so you have to be a little bit worried about the supplier. FAMA Supply, Facilities Management Supply, did find a source and did procure an initial allotment of KN95s. The advice right now on distribution is that departments, directorates, sections take a look at their personnel, and those personnel who are at greater risk, which would be those who are facing large group, forward-facing, talking to large groups, who have to interact closely with large groups or multiple groups over hours of the day, we would recommend that, yes, put in a request for 2 masks per person. Right now, we have that limit until more of the supply chain can pick up. And you can make those requests through the FAMA Supply. There's a form that they have that should be sent out. If it's not already, it should be sent out shortly for departments, for directorates, for sections, whoever it may be, to validate their need and put in a request, and it will be provided.
Super, thank you. Can you remind us, inside all classrooms, there should be disposable face masks, hand sanitizer, wipes? Is that still the case?
My understanding is yes, with the exception of hand sanitizers. I'm not sure that they have replaced that in all classrooms, but there should be masks and there should be disposable wipes. And in some cases, there are some hand sanitizers, but I don't believe that it's in all.
Okay, wonderful. Wonderful. I want to be mindful of our time, and so I'm seeing that it's 12:42, and so I might pause and just see if there are any questions from the in-person audience, maybe give you a second to think about if you'd like to ask something. If so, you can make your way over to the microphone or holler at me, and I will repeat your question. If not, we'll go back to the panel so you all can think about what questions you'd like to tee up. We do have a bank of questions that I'd like for the provost and the chancellor to maybe give us a little bit of background perspective on with regard to remote work. I think, Terry, you touched on some of this at the beginning. Can you give us a little bit more detail about the remote work policy that may be reevaluated? And tell us about why are so many campus offices putting out of office messages and not responding, and what's the expectation for those offices?
So the question is why the remote, the process?
I think it's a general question. There's a couple of questions I tried to boil to one, and maybe it didn't work, but it's about the remote policies. I think staff have questions about the remote work policies, but then also I think some people are experiencing trying to reach offices that may be closed. They may have an out-of-office message.
Okay.
So maybe talk to us about some of the expectations around that.
Okay. You know, we know there's going to be offices that are, some of the offices are very small, just a few people in them, and maybe everyone is quarantined or isolated, and they're not going to be able to be in the office. So that may be the reason for some of the out of the office. I do know that in one college that there was an office that was closed. I think they had 5 or 6 people that were ill. And so they had some personnel from a different department come over to keep the office open. So I know the campus is responding well to the problems that we're having right now. They're doing that very well, but there are a few cases where the office is closed. We prefer to have the offices open if possible, but we do understand right now where we're at in the middle of all of this. So from that standpoint, I think that's it. As far as if you're working remote, the phone systems that we have are excellent. We should be able to respond, and actually, in many cases, your office phone, you can pick it up on the Teams and answer it from home if you have it set up properly. So we should be able to respond very well, even if we're working remotely, to the phones that are calls. As far as the teaching, the remote, the illness, having a class that needs to go remote, that's handled by the department chair. This is just like if we handle illness throughout a regular semester. If that person can teach remotely, that's certainly an option, but sometimes that person may be so ill they're not able to teach. And in that case, as we've done for many years, somebody else many times will step in and teach for that person. So there's a variety of ways in which we're handling this. The illness is something we've dealt with for many years in covering classes, but the volume of it right now is what is up. And so being able to respond to those needs, it's a difficult time, but I think hopefully these are temporary measures that we'll get through in the next few weeks.
Yeah, I just want to underscore that we don't have to utilize the remote work policy to work remotely when you are doing so on an emergency, from an emergency situation where you have to meet the needs of people. So you can institute, remote work as needed to meet the challenges of keeping an office open, and you can have some people who may have to work remotely, but have that office open with those people who can work face-to-face. That's the expectation, that you nuance in that way, but you don't have to go through a remote work policy request, because you're not asking to have this as a permanent condition. It's temporary. You're utilizing it strategically to meet the challenges of the day, the week, not the semester.
I think one of the things too we might do as a next step perhaps is have an HR-focused discussion where we can really drill down into some of those questions. I'd see we've got a question from a member of our audience.
Yes, hello.
Hi.
This is kind of a question both for Coleman and the Chancellor. So I was looking through the university budget, and about $252 million comes straight from students and the tuition we pay. So that's the majority of the university's funding, about 25%. Coleman, do you feel like students are well represented enough? Because I know as a student, we're the ones that we're paying for most of the university for it to operate. So I feel like we should be involved in discussions before the university is closed. So, and then also for the Chancellor, how are the students involved in discussions before our form of education has changed that we're paying for?
Coleman, do you mind if I take that?
Sure.
First of all, students are extraordinarily important to the University of Arkansas, and I don't know what the amount is that, a student percentage exact amount of the budget, but regardless of it, it's extraordinarily important to us. There's no higher importance than to meet the needs of our student body, both our graduate and undergraduate students, online, remote, however they might exist with us. In terms of making the decision on what to do, of course I talk to the students. I talk to student leadership. I talked with graduate and undergraduate to talk about some of my thinking relative to this issue. So I think there may be a misunderstanding of how engaged student leadership is already in the existing kind of practice of how we operate. But student leadership is regularly engaged in major decisions that we make. There's not a time when we close the door and say the students don't matter, or their thoughts don't matter, that their concerns don't matter. But there is not, as I said, complete consensus there, because when I talk to undergraduate student leadership, I may hear one thing. When I talk to graduate student leadership, I may hear something that's very different.
Okay, so quick question after that. So how exactly, what is the process for deciding on changing the form of education? So is it like a vote?
No, it's not a referendum. No, no, I've got enough to then hold a referendum on that. Yeah, that's its own, that would be its own issue. But it involves conversations with many stakeholders. The faculty were part of that. I did talk with Coleman, I talked with also Catherine to discuss where the challenges were. The deans were involved in this. And so staff, I wanted to do more in this particular case. I didn't have a meeting with staff Senate leadership, but I like to involve staff as well to have a sense of where they are. And then you look at all the conditions, including the what's happening other places, what are the current conditions, and then you make a call. And it doesn't preclude you from making a different call later. It's just that's generally the process. Lots of conversations with different members of the community, stakeholders, leaders, and then you get a sense of where you are. And as I said, there was a huge misperception of where we were going. There were people who really believed, they were convinced that we were looking at going virtual for the entire semester. That never was a consideration. Faculty Senate never asked for that. They came to me and asked me for some very specific times that I might consider some nuance, but never a time when we would all be remote, but it was a matter of creating flexibility in that decision-making among faculty.
Thank you.
Coleman, did you want to respond as well?
I appreciate your question a lot, and also for bringing up the fact that I do think students should be at the forefront of every decision made at the university. And I really appreciated whenever I started hearing rumors around a decision about possibly going virtual. It didn't seem like for the whole semester, right? That Chancellor Robinson and I did have a conversation, and I made sure that he knew that students wanted to stay in person, and that that's because that's the experience that we've signed up for, to come here and have that classroom learning environment. And so don't worry, I'm advocating for us over here, and I really appreciate the decision made to ensure that we're having that experience. So thank you.
Thank you.
Super, thanks. I've got a question from the Zoom. I'm communicating with Mission Control to get the Zoom questions. This is sort of a general question. It was also submitted from in my list here about mental health resources. Are we planning to increase mental health resources for faculty, staff, and students during this prolonged pandemic? And I might just park it and just let the group tag team it.
I'll let Huda answer. I know the answer is yes, but because
Well,
I know we planned for that for the school year. But go ahead, Huda.
Sure. So no, definitely I'll speak to it from obviously a medical perspective as well, since a lot of primary care physicians and nurse practitioners, at baseline, we always see a lot of mental health issues with our patients. That has only steadily increased, unfortunately, through the pandemic. Through people becoming more isolated, we're definitely seeing more anxiety, we're seeing more depression. We're also seeing more issues with physical health as well, people being less active, being kind of connected to their PCs at all times. So I know as a community, as Fayetteville, we could definitely use more and more mental health resources, not only for our students, faculty, and staff. We don't have CAPS representation here, but we do have a counseling department. And within that counseling department, we also have a part-time psychiatrist, and we actually just hired a full-time psychiatric nurse practitioner. For our faculty and staff, we actually have a part-time psychiatrist that actually resides in our primary care clinic. And we also have integrated behavioral health, which is supervised by our psychology department. So all of these resources have been added to the services at Pat Walker Health Center. We are starting to see more and more psychiatry in our Northwest Arkansas, which is something that is definitely needed, but that has drastically improved over the last 3 years. So we listen, but as a primary care physician, I'm seeing it, even anecdotally, and patients of mine that never had anxiety or depression before have now developed those types of symptoms through the pandemic. And so, we are very cognizant of it, and we're not, we don't live in a vacuum. This is an issue that's facing the entire country. And there's not a corner of this country that couldn't use more mental health care. There's also, I would also throw this out as well, is that, health insurance companies need to be able to cover services for mental health care better. They need to reimburse better. So we have people that are able to keep their clinics open and able to see more clients. So, that's a national push, obviously, that we're all behind. But it's very important. I think we're very lucky on this campus to have the resources that we have for our campus community and to have the support behind us to allow those resources to grow. I will also add a few more things, Laura, is that I know I speak for the majority of us when I say that I wish we could have all been more proactive, right? If we could have had more and more people vaccinated, we wouldn't have this ongoing transmission and we wouldn't have all these variants. But we have to deal with the reality that we are faced and the fact that our campus actually is pretty well vaccinated. We are higher than our county, our state, and even the country as far as percent vaccination rates between our students, faculty, and staff. At least for Arkansas resident students, we know that's the case. And so, but we have to face the reality. We're all tired. I mean, we're all COVID tired. But the virus is not tired. The virus wants to survive. And as long as the virus continues to be allowed to be transmitted, it will potentially form another variant. There's a lot of talk right now about, oh my gosh, Omicron is it. And hopefully after this, now COVID is going to become endemic, just like the flu is. I would hope for nothing more than that to be the case. But we don't know. There's always a potential for another variant. And so I would be remiss if I did not emphasize multiple times vaccination. This campus has done, I think, lots of different things to try to get our campus more vaccinated. I think they've done a great job offering lotteries, raffle drawings, I mean, whatever you can think of to try to incentivize getting vaccinated. And we'll continue to do that. The work is not done. In addition, I'll also say that those of you out there who've not gotten a flu shot, the flu's not gone because COVID's here. And right before the finals occurred this last fall semester, we saw a huge spike in students presenting with influenza. A lot of folks have focused on just getting their COVID vaccines, which is amazing, and getting their boosters, but then the flu shots have kind of fallen at the wayside. So I encourage all of you that have not gotten the flu shot to please get the flu shots as well.
I think piggybacking off of that, on Tuesday, we do have a vaccine clinic that is sponsored with Pat Walker Health Center and student government. And also that'll go with the messaging. We want to be sure that students are getting vaccinated and our whole campus community is.
That's great. Thank you for that. I wanted to also share that over the Zoom, Trish Watkins, who's Staff Senate Chair, she's attending this session via Zoom. She wants to reinforce that staff also appreciate the university's flexibility with last-minute closing of public schools. It's not always easy to arrange childcare at the last minute. So thank you, Trish, for sharing that via the Zoom, and we're sorry you couldn't join us here today. I think since we are now about the end, I'm going to put the Chancellor on the spot and see if you have any closing remarks for us to send us on.
I saw Catherine, and I think she had a question.
Oh, is that right? I'm sorry.
I did, thank you so much. You guys mentioned the COVID testing drive that's currently going on, will be going on until February 18th. Are there any large-scale testing events planned for the rest of the semester? And second part of that question, the testing at Pat Walker and any other testing events, are there going to be any prerequisites or costs associated with testing? Thank you.
Super. Huda, do you want to take that one?
Sure. Let's talk about the PCR testing that started in the Union Mall by Crossroads Telemedicine. That's an independent group, again, partnered with the university. It's a walk-up clinic. It's really for the university community at large, so university ID and an insurance card is required. They say they do have the capacity to do hundreds of tests each day. I know that yesterday, Captain Mills got, I think, a report that they completed about 130 tests yesterday. For the first day of school, I don't think that's too bad. So that will be ongoing through February the 18th. As far as Pat Walker Health Center goes, boy, it's always a balance. We definitely have a large volume of patients coming to us that are having upper respiratory symptoms and wanting to be screened for COVID, which is really a responsible thing to do. So we are doing respiratory appointments through Pat Walker Health Center. You can actually go online and schedule that through the portal. And we are doing rapid COVID testing. If rapid COVID testing is negative, obviously we do other things as well as flu testing. Obviously other diseases still exist. People still get pneumonia, they still get strep, they still get mono. So we're doing medical evaluations to find out why that person is ill. We're still running our drive-up PCR testing in our back parking lot. We have a couple of tents up, and we're able to accommodate dozens of tests. Again, the issue that we have is staffing. In order to do all of this, in order to test, in order to take care of patients, in order to answer phone calls, in order to vaccinate, you need medical personnel. And, we're not immune to illness either. And so that's been an issue. And unfortunately, you've also seen a lot of medical professionals across the country that are leaving the medical field, finding more lucrative positions elsewhere with lower risk. Because frankly, the medical communities are getting very tired. My heart always goes out to the emergency room, physicians and nurses. As far as charges go, I'm gonna probably screw this up big time, so apologize in advance. If you have insurance, basically the cost of the testing and the visits will be billed. Some of our testing is actually, we receive from the state's allocation. So some of that is the rapid testing. So we receive that from the state. That folks will not be charged because we weren't charged for that. But in order to continue to have our facility exist and to ensure the viability of our staff and the resources for this campus, we can't work with no budget. I mean, that's the reality. We wish we could, but we can't. And so we try to make it as cost effective for everyone that crosses the threshold of our facility. And if folks don't have insurance, we definitely work with those individuals. Again, we don't want finances to be a barrier to getting adequate care on this campus. But if you have insurance, obviously we will take that insurance and bill for the costs associated for the visit. And that's a transparent, honest answer.
Can I add one thing real quick?
Please.
So we've messaged this a bunch and we've harped on it a lot, but it's vitally important that we reiterate again. If you test positive at an off-campus site or even at the Union Mall because it's run by a third party at this point, we need you must report that through the self-report form located on health.uark.edu under the COVID-19 site. That allows us to see what we actually are experiencing on our campus. The only active cases that we count are those who have been on campus. So we get a lot of reports of folks who've tested in Texas or Louisiana or their home state that we follow up with from an HR and or student through UA Cares perspective, but they're not counted as an active case because they were not on campus. So that self-reporting mechanism is vitally important if you're tested off campus or through a third party like that is running at the Union Mall right now. We have to have those reports filled out and submitted.
Would you like the last word or shall I wrap?
Sure. I would just want, again, to compliment the campus community for the work that you are doing. We've been in this for 2 years and we're doing really well. And we need to just keep going. If we keep going, we will, emerge from this when the world does. A much better institution, much stronger institution. And I mean that. And that's not just something that I'm qualifying, I can quantify it. We are doing this right now. We have to have the compassion to work together and to be strategic in our approach. And we will emerge out of this a much better and stronger institution. And I just think, that's what I know. This is not just my interpretation. This is what I know. We are doing this right now, and we're doing it at a very high level. And we will emerge out of this even better than we were going into it.
Well, thank you very much, and thank you to our fine panelists. We appreciate your time. Thank you for those of you who have joined us in the live audience and on Zoom. And that concludes today's panel. We look forward to meeting with you again soon. Stay safe.
Thank you.